Hello, everybody. Welcome to Aware and Care, a weekly Ayurveda program where we talk about our health, our mind, our body, and every other element that is bothering us. The Ayurvedic perspective, that is basically most of the time, our doctor here in the house, Dr. Ambika Nair, recommends lots of home remedies. This is a series where you put in your questions, we answer them through this program called Aware and Care. Over the last couple of weeks, we've had many people messaging us talking about skin care. How do we take care of our skin? I guess over the time we have learned to moisturize the skin and just take care of it, keep it clean. But friends, this is one of the biggest organ of the body, I think about 22 square feet, that takes care of all the other organs. The more we take care of it, the more we feel good about it. And it is the first organ that comes to anybody's attention first. So let's first welcome Dr. Ambika Nair to the program. She's the co-founder and chief consultant at Santhigram group of companies. Welcome her to the show and also ask us, how does she manage to look so beautiful and glowing in every episode? Welcome to the show, Dr. Nair.
Namaskaram.
Namaskaram. So our first question today to you is, how do you manage to look so glowing in every episode? You have a hectic schedule and you also do these talk shows and you meet hundreds and thousands of clients every day. And yet you always have this little glow on your face. How do you manage to do that?
After seeing you, my glow comes. Yes.
So I think joy is always
every question of Madhavi, it illuminates in me, So
that is what it is, friends. Body, mind, awareness. Dr. Ambika Nair is so aware that she knows when to answer what. Dr. Nair, you just mentioned that, the skin is the biggest organ of the body, about 22 square feet, about 8 pounds sometimes we could say. And as much as I don't like it, it is the reality of life that we age. And the first thing that gets affected is our skin. And I'm sure skincare, when we talk, it's not only about women, it's also men, children, everybody. But when it comes with aging, 40 plus, I guess that got our attention of many of our viewers. 40 plus in skincare, we want to talk about that today. Let's start with the basics about what the skin is, what is this composition of?
Very good subject you're giving me today. Okay. See, according to the Ayurveda, this is types of skin actually. Even though we know that dermis, epidermis and everything, but like Vata, Pitta, Kapha. So I can tell about you. Okay. So you are like a Kapha and Pitta. Okay. So, like that's why sometimes, because that's why you look chubby, you look glowing always, because you are, slimy skin, little soft skin, little cold skin, and more fair. So you are a Kapha. So only problem with you is that because excess of oil comes sometimes on the face. So that's why like when your digestion is okay, we have to see certain things also in this. But like the type of skin, that's what we see through the pulse or we analyze them. Yeah, pulse analysis. Then only we will be able to tell that how to take care. So each one I will be telling you, like I will tell everything like that. Okay.
Awesome. So basically you're saying that you will first start with a pulse analysis about the skin type. And usually, doctor, does the skin change over the time? If I am a Kapha person, was it possible that when I was a teenager, I was Pitta?
Teenage is always Pitta, my dear.
Always, okay.
Yeah, okay, because that is the time you want to do everything. You don't have any, always shortage of time. You're very enthusiastic. That is your tejas. Means your Pitta is on the higher side.
Okay.
But so everything, depend upon the condition of the body also. If your metabolism is good, if you don't have excess kapha, or if you don't have any other disease, like that. Okay, not that every Pitta will be perfectly all right or anything like that. Okay. So kapha people make the digestion.
Yeah. As I mentioned that, I may not like it. Many of the people around the globe do not like it, that they say we have to age gracefully. And of course, with today's times, with gadgets and our lifestyles, how much are we able to spend time on our skincare is a completely different topic, because we have so many products claiming so many other things. But today here in this program, friends, we are going to talk about how to take care of your skin and what are the problems that are coming with age, especially for 40 plus aged people. Doctor, should we mention women and men?
Women, let us talk about women. We will go
Okay.
for the men. Otherwise, both can be included, no problem.
Both can be, because I think basic care would always
Yeah,
be the same.
hormonal imbalance actually.
Yeah,
Changes
hormonal.
comes with the hormonal imbalance. We have to see that whether you are really doing good with your hormones. 30 or 39, 38. It's not. Some people will come with so much of freckles, and like they look very old for their age. So
Yeah.
that are called Vata.
Vata, okay.
So they won't sleep properly. Their skin also will be like like very dry, and like a dark complexion. You will not say that because people in America is not
People
like
get
Vata, but it is all
yeah. The
different.
complexion is, everybody's skin color is a little
Yes,
different. Of course,
yes.
that condition is there. So, doctor, let's start with the basic questions here. Now we're talking about aging, age-related skincare also, because 40 is an age where a lot of things happen. Sometimes we women come to a point where we feel that, okay, whatever has to happen will happen. I don't want to bother about anything. But that's when we suddenly look in the mirror and realize that everything about us has changed, starting with the wrinkles, the crow lines, the laugh lines, everything has come, pigmentation, dark circles under the eyes, all these aspects are there. I'm going to give you the liberty to pick which of that particular problem that you want to pick first and explain why it happens and what can be done.
No, that like especially I told you about the kapha and vata. So
Uh-huh.
I'll tell about the pitta. They will have always soft skin, warm, and like they are, like you can see like acne in those children. Like not only children. I'm telling you about ladies.
Ladies, yeah.
Okay, so when the hormonal one, they will tell that, oh doctor, I never used to get pimples during my teenagers, but I started getting
Uh-huh.
pimples now.
Uh-huh.
So what is that? This is actually like because of the like constitutional changes.
Wow, okay.
That is their prakriti changes.
Mm-hmm.
They started putting on weight.
Mm-hmm.
Some people will tell that before I was very thin. Now after the delivery also, because ladies actually I am addressing more today.
Mm-hmm.
I'm telling like after the delivery, after 38, 39, they put on a lot of weight. They
Mm-hmm.
were their color complexion has come down. They used to look so vibrant.
Mm-hmm.
They started looking like like a luster is not there on the skin. So they will tell that glow is not there.
Mm-hmm.
We see that look at her face, how the glow. But we will ask what product they are using. It's not a product actually. It's all from inside.
Beautiful. Okay.
Yeah, because actually pitta is the thing. What is, if your pitta is good, you will have a very good color and you will have a very good skin.
Okay.
I'm not talking about fair or some color of
I
the
get
skin
it.
means that that look, the
I get it.
texture, that you will understand how nice it will look. Vibrant skin actually I should say.
Friends, when we are talking in this program about skincare, many times we use certain terminologies which is not about profiling. It is just about understanding the texture of the skin. Certain terms and words are used just to understand about the skin condition, and it is not about any kind of color or any kind of particular profiling that is happening in this program. So, doctor, you just mentioned about inside and outside. I think I wanted to get to that question, saying that the skincare starts with internal as well as external. Let's
Yes.
start with some internal factors.
Internal factors you have to see, like a tongue diagnosis is done.
Mm-hmm.
You yourself can also see that if you have a quarter tongue, white
Mm-hmm.
quarter tongue, so you should understand your stomach is not good. Sometimes
Oh.
they will tell that, okay, I feel bitter taste in the tongue. So
Mm-hmm.
this all, that, gurgling sound in the stomach, a burning sensation in the stomach. So there is something wrong with your pitta.
Mm-hmm.
So sometimes, your bowel movements are not okay. Sometimes you go frequently. So
Mm-hmm.
it can be related with any other disease also. So anything related with the pitta means, like your skin will look, you will look so tired.
Okay.
And, like whatever you do, your absorption of the nutrients are not in the same way.
Mm-hmm.
So there are so many factors in that.
So
And there, yeah.
this happens for mostly during after 40s. I mean, this kind of sudden change in the body of your digestion or irregularity
Yes.
happens.
Yes,
Okay.
not only that, some people will get, because if they are early menopause means, that they will get like 36, 37 and all.
Mm-hmm.
This all depends upon the hormones actually. And if you are having thyroid also, that also because your calcium absorption has to be checked. See, hair, nail, skin, bones, everything comes in one group.
Right.
So we have to see that whether you are your, your minerals or whatever, like everything, whatever you're taking, it is absorbed well in the body, so that your assimilation has to be seen.
Right.
How you are doing, whether you are having any diarrhea, whether you are having any other issues, any asthma patients or anything like that, because you lack certain things in, like in the food, what you cannot eat, what you are
Doctor,
overeating.
yeah, you just mentioned about food. So does it mean certain medications also affect your skin condition?
That's what I told about the, some diseases.
Thyroid.
If you are, not only thyroid, see some, like cancer patients are also there.
Okay, okay, I get
Okay,
what
and
you're saying.
like then arthritis patients are there.
Mhm.
It's not like a 40. Even before that, we get a lot of, like youngsters suffering from all these
Mhm.
diseases. So,
Mhm.
but we have to see that how to make them better.
Okay. So these are some of the internal factors that you mentioned about, these affect the way our skin looks and what we feel internally also is coming. This is only the physical constituency that you're talking about. Now, when you talk about internal, we also should talk about emotions, right, doctor?
Emotions play a big part in these things, actually. If you
Okay.
are emotionally down, small, like especially kapha people.
Uh-huh.
Kapha people, they get affected a lot.
Mm-hmm.
Kapha and pitta, everybody get affected. Kapha means they will be lingering at the back of that.
Wow. Okay.
Small things will worry them.
Hmm.
Then their
I
sleep will be
just started
disturbed.
to breathe a little hard.
Yeah, sleep will be disturbed. Sleep
Mm-hmm.
will get disturbed. They will not be able to focus on anything. They will not be able to eat proper food.
Mm-hmm.
Everything, So stress is also one of the big factors for that, actually.
So that can also affect the skin big time. You mentioned stress, you
Definitely.
mentioned sleep, which is both very, they always talk about beauty sleep. And I think after 40, I'm not sure how many women are actually getting their beauty sleep as in a terminology, because we are always restless and worrying about a lot of other things apart from ourselves also. So doctor, please continue with the other aspect where we just spoke about emotions. Let's also talk about the mind. Emotions and depression, feelings, all, I think they are interconnected. This fear about aging, that captures many of us commonly, that what will
Yeah, that is a very good question, actually. Some
Mhm,
people are afraid, like they get depressed a lot, actually.
mhm,
Yeah, they don't want, they don't have the, like a
uh-huh.
graceful aging.
Okay.
Some people, they just have like a very bad changes, like you can see a lot of freckles in the body, or
Mhm.
on the face and all. See, that is all related with any other diseases, not just like that. So
Okay.
that has to be seen, actually.
Uh-huh.
Freckles will be there, then, like changes in the skin.
Uh-huh.
Not only freckles, you can see the discolorization on the like around the mouth
Mhm.
and under the eye, discolorization on the, like neck area.
Wow.
So, like people will be so much, like they don't want to accept that, actually. So that aging means they are afraid. Oh, we are getting, like they get, don't know, I don't look like before. People come and talk to me like that, like, oh, no, I look elder than my age. I always look elder. It's not like that, actually. Then, like we pacify them, we
Mhm,
correct them, their
mhm,
thought process.
mhm.
And there are certain things also, after the consultation, we, like we have to decide what they need. Okay, what type of medicine, what type of herbs, what they can do at home. So
Okay.
many things, whether they need any panchakarma,
Uh-huh.
whether they need any other way of, counseling, like that's what I'm telling. Yeah.
That is done. So, doctor, as you're talking and mentioning so many aspects about the internal part of, how to take care of the skin, or what are the reasons that affect your skin care, I'm just trying to recollect many a times any woman out there feels very complimented when they say that you look younger than your age, or oh, that's your son, he looks like your brother, or that she doesn't look like your daughter. It's such a gratifying, or maybe such a complimenting moment for anybody, because I think age is again a factor there. Now, doctor, we just spoke about all the internal factors. Let's also talk about the external factors that affect the skin. It could be chlorine, it could be pollution. I will let you continue with what are the external factors that could
Yes.
damage your skin at 40.
Yes. Yes. Like of course, pollution is one of the major things. Especially if you go to Delhi, means you will come back in a different state. Okay, but here in US, actually, at least we are saved. I should say that.
Yeah, but I think we also have the complaint of about constant heaters and
Yeah, that is
ACs.
there.
That
But
is
at
also
least, like they're induced, but that is
yes,
outside,
chemical
you cannot go
pollution
and
is not.
breathe the air.
Mm-hmm.
You cannot go and breathe the air itself.
Right.
So, yeah.
So these are a couple of factors which you say externally which gets affected. Anything else that comes to your mind, external factors that can affect your skin, which could damage the skin, especially at 40?
See, using of chemicals.
Oh, yes. Skincare products also many a
Chemical
times.
products, that's the only thing what we see over here.
Wow.
Like we all run to the, beauty parlor. Please, I'm sorry for that. Okay. See, like all bleaching and everything, but you can do a lot of things at home actually.
Okay.
Yeah.
So I think that is
The
exactly
parlor
where we want to come to. Friends, today's episode, we're talking about skincare at the age of 40 and 40 plus, especially for women. And I'm sure most of the tips which Dr. Amika Nair is going to give here on will also apply to some men if they want to try it out. Most of the times, we always give a disclaimer. Please do a sample test before you do anything. And it's like any other product. Sometimes you could be allergic to certain home products also, even to turmeric or to honey. With age, everything changes. So, doctor, let's get to understanding how to take care of our skin after 40. What are the basic routines that we have to follow?
Okay, basic routines, especially for kapha people, we tell them to do, like Uddhavardhana. Uddhavardhana is a polishing of the body so that they can use that powder, Triphala powder is also good, but, Kolapulutadi is there so that they can use it, even Manjista powder.
Okay.
So they can mix and they can do the like a facial massage.
Facial massage.
Yeah, so that fat, the deposits, you can see like how hanging around, irregularities, so that will come down.
Oh,
And you look very good actually.
okay, that's good. So Triphala is something that you can take from any of the
Yeah,
local stores
anywhere
also?
they can buy it. Actually, see any powder, this is very good. This is like Upton, but it's very nice.
Upton. Okay, very nice.
Yeah, that is
So,
very nice. This very nice for the kapha. Okay.
so do you
Then
mix it with anything or with water?
no, dry powder.
Just dry powder massaging.
Dry powder, but slowly.
Okay,
So they can do like this. They can, all the contours will be maintained. They will look very, very beautiful.
Okay. So this is the one type of composition that you meant. What
Okay.
about the other body type?
Okay. Then comes, Pitta means it is little, like the thin skin, very soft skin. Okay. So when, you cannot do the Vardhanam for that. Only problem is that they are, like prone to get all the freckles and all.
Okay.
Okay. So, like we have to see the cause of that, but still they can apply chandan with milk. They can make a paste and they can apply. Or even with the cucumber juice also. It is very nice. It will cool them a lot. Very nice. Even Manjista can be applied.
And you mentioned 4 body types. We have completed 2. What is the third one?
No. Coming third, 3. Another one is coming. Vata.
Vata. Okay.
Vata, very dry skin. So Kungumadi oil, Manjista oil, this can be applied to them actually.
Any kind of
they
oils?
They need more oleation actually.
Okay, more oleation. Okay.
Yeah. Anybody, like Vata, see, not only this is only one type I'm telling, but the combined, like doshas are also there. No, if it is like Pitta and Kapha, Pitta and Vata, okay, like that means then it changes that because we won't be able to tell like that because unless we see the patient. Yeah.
So, doctor, what about a combination skin? If a person does a person have 50-50 of both the composition Vata and Pitta together, or maybe it is?
Yeah, that's what I told. At that time, we will tell them, like but this will not harm them actually.
Yeah. Okay.
Okay. It will only. They will look very good with that actually.
Doctor, as you're mentioning all these things, I'm still understanding and trying to recollect all these programs that we watch or the magazines that we've been reading over the times. People pick up these remedies just like that and try it on themselves, and they realize that, it's not working for them, but it has worked for their sister or their mother or their aunties or somebody. But then now you understand that, your body type is different. A cucumber juice could work for somebody else, but it could not work for you because your body type is completely different. So we are mass followers. We follow every tip that comes in the market, but Ayurveda teaches us to understand our body composition and realize that why we like certain things, why we don't like certain certain things and why our body responds to certain things. Such a beautiful episode that we are talking this evening here, talking about skincare for 40 plus, especially for women. I see a lot of women smiling there and trying to understand, why don't you talk about our skin or something? So, doctor, what about the skin treatments that women go through after 40? You must have definitely be seeing a lot of patients coming to you who have tried chemical treatments and they come to Ayurveda just for healing purpose after the skin has not accepted those treatments. Does it happen?
Madhavi, we get a lot of people like that actually.
Oh, okay.
Okay. Mostly like Pitta Vata.
Mm-hmm.
Okay, they will have so much of complicated skin, like all the, very dry skin, like scaly, like fishy skin, even eczema. That is actually very deep seated, like a crackled, like feet. Okay, so, like we do proper care for them and we tell them, like because what they can do it. This is all like Pitta, imbalance.
Balance. So,
What
doctor,
we tell them, yeah.
I'm just trying to understand as a friend to friend conversation. You so many times when these women, 40 plus women, or with due respect to everybody who's watching, who's done it for whatever may be a compulsion to go ahead for certain treatments, they never speak about whether this particular treatment will suit their skin type, right? They see that somebody has done it, they copy that, or they feel that that will also work for them. Then they come back with rashes, allergic reactions, and everything. So when they come to you with those things, how is the damage control taken care of here at this point? How is it done?
Actually, we get, like because see with my prescription itself, like people will start treating their own people.
Wow.
Yeah, because actually, recently for the anxiety, it was a very bad case of psoriasis also. So some
Okay.
medicine were given. So he has prescribed to his sister too. Then he told it was not working. I told it depends on after the consultation you are doing like this, don't do like that. I could only laugh out. Otherwise, what else I can tell? Because
Absolutely.
actually, people first of all they are shy type to come to the doctor and reveal their problems.
Hmm.
Yeah, their skin issues they try to cover. People, they don't want to come.
Friends, aging is a beautiful part of your life cycle, and skin definitely gets affected, whether it's internal factors, external factors, which most of the things which Dr. Ambika Nair has just covered, and things that we have not covered, I'm sure you know as to why your skin has become so. But if there is a concern and you feel that your confidence level has come down for some reason, please try out the herbal remedies or suggestions Dr. Nair is suggesting, and please do a test before that. And if for anything else, just have a small consultation with her and she will guide you as to what your skin type is. And she just gave an example of her, a patient sharing his or her remedies with somebody else and it did not work. And that is one big mistake I think we do many a times. And in most of our programs, Dr. Nair has also mentioned, please do not share medicines and remedies with anybody else because the body type is completely different. And that is what Ayurveda is about. Dr. Nair, please add to that.
Yes, okay. Then, like if the pitta is not, like a digestion is not okay. So what they can do at home, we will tell them,
Okay.
So we tell them, castor oil is there. We tell them to take 2 tablespoons of castor oil with warm water before they sleep. Okay, ginger water because it actually, like it take care of the bowel movement and everything. And not only that, their pitta will be balanced a little bit. Gas formation will go away, acidity formation will go away. This is very good actually. Then ginger water. I always tell them to take ginger water, ginger and coriander. One
Coriander powder or coriander leaves?
No. Whole seed.
Whole seeds. Okay, so how do you take it? How do you take it?
One teaspoon of whole coriander seeds
Uh-huh.
and 1 small piece of ginger. Ginger, you have to crush it. Then
Okay.
you can add like 4 glasses of water and boil down to 2 glasses. So it has become like a kashayam.
Kashayam. Okay.
Yeah. So quad. Okay. So then they can take it. Like after the meals they can take it. So it will really enhance your digestion and it helps a lot with the pitta also. It's a very good thing. Not only that, they can use like a few raisins.
Uh-huh.
They can soak in water and they can take it in the morning. whole night you have to keep it. Okay, so that is also a mild laxative. That will really, because when the toxins are accumulated, really all these things are coming. So that is all detoxification what you people can do at home actually. And for Vata people, again, lips are very dry, especially during this, because we are sitting with the heater 24 hours.
Yeah.
So he can apply little butter, butter is the best friend actually. On your, if you apply butter on your feet also, you will get a good sleep and your cracked, feet will be looking much, much better.
Any type of butter?
Any butter, what you have to go. No need to go.
Maybe unsalted butter is better. I mean, our viewers would also be having lots of questions on that. So butter definitely helps to keep the skin. And here you're mentioning about, friends, if you're just joining in, Dr. Nair has just mentioned about how to keep your system clean. That definitely helps to keep the skin better, and your glow or the suppleness of the skin comes back, the luster comes back, especially if you detox your system and you have regularity and your bowel movements are good. Yes, doctor, your next suggestion for the skincare?
Yeah, skincare, you have potato in your kitchen, right? So peel a potato, make little juice out of that. You can just, remove little juice. 1 tablespoon of juice, little bit of 5 drops of lemon.
Okay.
Little bit of honey, like 1 teaspoon. You can make a paste out of that, okay?
Okay.
And if you are, then you can apply on the face.
So this any body type or any skin type?
Any body type can use it actually. It will give you a good luster, glow skin.
Wow. Doctor, there is always this myth that, potato, when we are cutting potatoes, our skin becomes dark, or, we have that
iron is there. Iron is there.
Iron is there. So people do fear sometimes using potato on their face.
No. It is a good bleach too.
Oh.
Natural bleach. You can add, even yogurt in that actually.
Okay.
1 tablespoon of yogurt you can mix, but you can keep it for for a week. It will stay in the refrigerator. Yeah, so you can use it actually. So no need to make every day.
So you're making a life even more easy when you say you can store it for a week. So
I do all those things actually, and I use Kongomadi. I don't use anything else.
Okay. So Dr. Nair's, the skin kept secrets are also out, and that's what some of us can also try. But like I again said, please watch the episode and understand what your skin type is to try some of these home remedies. Doctor, you want to add some more tips for what about the dark circles and dryness around the lips?
Yeah, the potato, that will take care actually.
Potato will take care of that.
Yeah, that will take care. And Rekta Chandana is there. Red sandalwood powder is there.
Okay.
Okay, that you can mix with, like a honey, and you can apply. Even chicken pox, marks will go away with that actually.
Wow. So red
red sandalwood powder.
Yes, red sandalwood. It's a completely different sandalwood
powder.
Yeah,
because we are from Kerala, land of every spice is there. So everything is there for us. So it's very nice actually.
And today all these products are easily available, and if they're not available, Dr. Ambika Nair's clinic is right here in New Jersey, and they have multiple locations. If not, once your your consultation is done, they take care of your delivery of your products or your medicines that are required. And we are talking about Lal Chandan right now, which could help to keep your skin supple and yes.
If you are more dry and if you have itching, then that is Vata type. You should do Abhyangam or body oleation. If any oil is there, whatever at least you have, you can do it. I am not telling specific oil. Okay, but that they need it. Otherwise, the skin will go away. It will just wear and tear.
And how often should one do exfoliation of the skin after 40?
You can do weekly twice. At least weekly once. Here I won't say that twice because nobody has time over here.
Right.
So at least once, once a week. That you can do.
And what about cleansing of the skin? Do we use soaps or,
See, herbal soaps are very good actually. Yeah. Herbal soaps are very nice actually. Okay. Otherwise, you can make your own uptan. Okay, even with, rice powder, milk. So you can just, with the milk, that if you put it That is a very good exploration. That's very nice actually.
So basically, rice powder and milk by itself is good
Yeah,
for your skin.
yeah. Some people they put little bit of, oats can also be used
Okay.
instead of rice powder.
Mm-hmm.
So according to skin type, if I tell like a skin type, then everybody will use it and I will have more issues then. I don't want to tell that, but this all can be used actually.
Yes, it is again a disclaimer. Please find
Yeah.
out your skin type and
And
try
even
these
in
remedies.
non-veg also, there are very good things, like what you have.
Mm-hmm.
Egg.
Okay, egg also. Okay.
Egg white is a very good cleanser, and it helps you
Wouldn't
with
it
the
smell?
egg white. Egg white, you can put one drop of like olive oil or anything like that, or castor oil.
Okay.
Okay, make paste and put it. Then afterwards wash it. Otherwise, if you are having like so much of wrinkles, what you should do? Egg yolk.
Mm-hmm.
One yolk, like you can take, add 5 drops of honey,
Uh-huh.
5 drops of castor oil.
Okay.
Mix, make a paste and apply.
Okay. So a little bit
Keep
of
it for
discomfort
30
is still
minutes.
there, but then I guess it helps the skin, so why not? Once a
My
week.
God, it is very nice actually. You
Okay.
won't get any wrinkles. I can guarantee you.
Okay. So that is one remedy. Everybody is running to the store to pick up some eggs and try some remedy with the yolk this evening. Uh,
Mm.
Doctor, there is this condition. I mean, you did mention at the beginning or in the middle of the program when we talk about this fat accumulation on the face, and many a times there is
Hanging will be there,
hanging
sagging.
will be there, and it changes with the day and it changes with the week. Sometimes a person looks very chubby, sometimes they look very, very squished out. This is all because of the internal system that's happening, and that can also be taken care
Kapha.
of. And any other facial exercises or massages you did
Facial
mention?
exercise they should do. They should do yoga, breathing exercise. They
Mm-hmm,
can do nasyam.
mm-hmm.
They can do shirodhara. Okay,
Okay.
the shirodhara cannot be. At least they can put good. Like massaging your body itself, it will make a lot of changes actually.
And the most
We do
important
in
exercise,
Kerala.
I think the most important exercise is to laugh that you are at 40 and crossing
Laugh is
40, and you did everything that should be done in life, and enjoy that, enjoy your mistakes and not repeat them, and guide other people, just like Dr. Nair is just suggesting now. So, Dr. Nair, have we covered everything, or you want something else to be covered and mentioned in this program about skincare after 40?
Okay,
Any special?
if you want to glow more, you
Uh-huh,
can take like a spinach juice with the
uh-huh.
turmeric.
To drink or to apply?
No, to apply. You can you
Spinach,
can you can do that at home today.
spinach juice and turmeric, mix it, apply to your face, maybe 10,
Yeah,
15 minutes, and then wash it off.
wash it off. It's a beautiful thing actually. Even
Wow,
bitter gourd juice is used for acne.
that is true. Yeah, I think that is grandma's remedies we've always heard in childhood, that to avoid
We use that.
pimples and
But
acne.
like a rose petal with the honey, there are so many things. You can make a paste. You can add little bit of basin also in that. So there's all. There are so many things in our home,
That we
but
can take
people
care.
don't use it. What to do?
So, to Dr. Nair, those were some of the wonderful tips and suggestions you have given to women crossing 40 and entering a beautiful phase of their life to look even more beautiful. How about certain vitamins would you recommend for which are good for your skin?
Sprouts are very good. Vitamin E, good
Right.
source.
Uh-huh.
For non-veg people, like a fatty fish,
Uh-huh.
that is very good actually. Then, like pumpkins are very good.
Mhm.
See, don't overeat, especially kapha people, don't overeat.
Uh-huh.
After 40, because the, metabolism slows down. So you are not supposed to eat too much. If you are eating like 2 chapatis before,
Uh-huh.
and, like 1 cup of rice or, like that, you have to make it half.
Mhm.
Because assimilation will be very, like digestion will be very less, and assimilation also will be very poor. So you start putting on weight.
Mhm. In
So
that
that
phase,
itself, sagging will come on the face.
yeah. And then people will try about weight loss remedies
Yeah,
and
that's what I'm telling. They will not. The skin has to be taken care actually. See, even at any age, like you see, like 70s and all, you will see that people will tell that, oh, look at the skin, how nicely, how glowing their skin is, what a luster on their face, what how lovely they looks. So this all, how they maintain it actually.
Mhm. So all this puffiness and skin sagging issues, these are part of life, but it can be maintained, it can be taken care of by these home remedies. Dr. Nair, a patient has a young woman has a 40 plus is coming to Santhigram. So what are the other suggestions and treatments that are followed at the clinic for somebody with skin issues?
First of all, nowadays we will ask, whether they have done the COVID test. If it is negative, we will call them to the clinic. Then I will see what constitution, what is the root cause of the problem actually. Why the skin has become like that. Okay, so if any other underlying diseases or anything like that, then we will treat for that. And we will give the diet also. Herbs are also given. If panchakarma is needed, we will tell. Otherwise, what they can do at home, we will tell them.
Oh, this seems to be one of the most easiest remedies that you have given today, especially for such an important aspect. The skin, the largest organ of the body, which covers our entire body. And I just mentioned about 22 square feet. That's a lot to take care of. And with such simple and easy suggestions by Dr. Ambika Nair of Santhigram Group of Companies, I think life is beautiful and skin definitely is beautiful after 40 plus. Bring that cheer on, keep that smile on, and every problem that is affecting your skin is just not worth it. Right, Dr. Nair?
Yes.
Thank you so much once again for this beautiful episode. Friends, once again, if you have anything that you want us to cover, just like this skincare program that we just did today, feel free to message us, comment, or send an mail to Santhigram Group of Companies. We will take care of it. Thank you so much, Dr. Nair. I look forward to the next episode with you here on Aware and Care.
Only bother about your digestion. Everything will fall in place. Thank you so much.
Thank you.